How to implement telemedicine in hospitals or clinics in 8 easy steps. 8 simple steps. 1. Define your goals. 2. Frame viable strategy. 3. Develop a timeline for implementation. 4. Telemedicine platform development. 5. Create a visually appealing platform. 6. Train staff members. 7. Proper marketing. 8. Monitoring and enhancement. The demand for telemedicine is exponentially rising from the patients, and therefore hospitals and clinics have started to look for telemedicine platform development. Remote patient monitoring, RPM, or telemedicine as it is known, is beneficial for the doctors and customers. It is also referred to as online doctor consultation and mobile health communication, EMhealth. Online doctor consultation is considered an efficient way of saving time and money. It is especially beneficial for the hospitals located in distant locations where mobility may be an issue, as they can serve customers anytime from anywhere with ease. What is telemedicine? Broadly, it provides cost-effective and accessible healthcare to patients with the latest communication and internet technologies. World Health Organization, WHO, defines it as the delivery of healthcare services, where distance is a critical factor, by all healthcare professionals using information and communications technologies for the exchange of valid information for the diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and the continuing education of healthcare workers, to advance the health of individuals and communities. Different modes of telemedicine. Multiple modes of communication can be provided to facilitate telemedicine. This includes different communication methods like video, audio, and text, chat, email, messaging, etc. 1. Online consultation. In this mode, patients can connect with the doctor virtually for medical consultation. There is no need to step outside for that. 2. Home visit. Here, patients can request their preferred doctor's home. They need to confirm and schedule the appointment. This is very useful when a patient has severe mobility issues. 3. Clinic visit. In this mode, patients can book their prior appointment at the clinic to avoid having to stand in long waiting lines. Telemedicine has plenty of benefits for the patients as well as hospitals. To know about the benefits of telemedicine in remote areas. So far, we have learned what telemedicine is and what are the different modes of operation. Implementing a telemedicine platform in your hospitals or clinics is a process that involves many steps. Now let us look at the steps involved in implementing telemedicine in your clinic or hospital. 1. Define your goals. Firstly, you need to identify the needs of your hospital or clinic and be clear about what you want to achieve by implementing a telemedicine platform. This ensures that your goals align with your expectations. For example, your goals for telemedicine implementation may include: limit clinician exposure to COVID-19 and minimize the risk of infection. Increase clinical capacity to manage the surge of patients. Extend access to consultations from the specialists. Increase patient engagement. Provide better quality patient care. Implementing a telemedicine platform is to maximize the clinic's utility and efficiency and provide quality services. Establish short-term and long-term goals and ways to achieve them. 2. Frame viable strategy. Develop a clear strategy to align your objectives for this program with the operation of your clinic, and communicate the strategy to the staff members to avoid any misunderstanding. For example, If you want to focus more on video consultation and less on audio or other modes of operation, make staff members aware of that. Strategize how you meet the financial necessities, how you manage the infrastructural resources, data and other vital assets. Also, define and periodically assess the matrices to measure the program's outcome. 3. Develop a timeline for implementation. This predefined time frame for all the steps will enable the smooth implementation of the platform. It will also give the telemedicine platform development company sufficient time for quality assurance and testing. The clinic should outline the timeline for the different stages of the project. The telemedicine platform implementation includes many factors, including market assessment, the goal of your organization, development of the platform itself, etc. 4. Telemedicine platform development. Decide whether you want to develop a telemedicine solution in-house if you have an internal IT team or want to hire a telemedicine platform development company. If you lack expertise in the healthcare IT field, chances are you will find many hurdles in understanding and complying with the rules and regulations pertaining to telemedicine. That is why it is advisable to consult with a healthcare IT expert company as an external technology partner so that you can work hassle-free on your existing workflow. When selecting the perfect vendor for telemedicine platform development, there are many things that you should keep in mind. Analyze the pros and cons offered by all the alternatives. To choose the right development partner, use the steps mentioned below to ensure you select the ideal technology partner. Understand the features offered by the telemedicine platform and make sure all your requirements are covered. What type of technical support will you get during and after the deployment of the platform? Whether your data will be securely stored as per HIPAA, Health Insurance Portability and Accountability Act, or not. The platform needs to be compliant with the various privacy and security regulations to protect the critical health information of the users. Verify the traffic handling capacity or scalability of the platform. Whether the platform is easy to use or not. For easy adaptability, the platform should have a minimum learning curve. Whether the platform can be customized in case of your organization's specific needs. Identify the timeline to develop, test, and deploy the telemedicine platform and verify whether it is in line with the intended implementation timeline of your organization. Clarify the total cost of the solution, including development and support. Take your development partner's help to identify the recurring cost of hosting server and any third-party integration like payment gateway, live video SDK, etc. Ensure that the development partner you select can provide a stable, scalable, secure, usable, and bug-free platform using the latest technology. It is a long-term partner who can support you technically. 5. Create a visually appealing platform. The telemedicine program has particularly unique needs, such as a robust platform and a lucid user interface, UI. The UI should be as simple as possible to make sure that users don't face any difficulty in using your platform. With minimum clicks, staff and patients should access the required features or information. In addition to visually appealing, the platform should be easy to use. 6. Train staff members. As telemedicine technology is relatively new, it is good to train the staff members and teach them how to use it for maximum efficiency. The training should encompass all the aspects relating to telemedicine. 7. Proper marketing. When your clinic successfully implements telemedicine, it needs to market to the broader audience about this new offering. Otherwise, very few people will get to know about it and benefit from it. Keep your targeted user base in mind while marketing your platform and advertise how to use your platform. 8. Monitoring. Hospitals or clinics should monitor the results of telemedicine implementation over time to determine whether additional improvements are required or not. Evaluate the outcome against your predefined matrices to understand the way the platform growth fares from your expectations. This assessment may also give you an idea about whether to expand your services or retract them. 9. Enhancement. After this assessment, sometimes you would like to add new functions in the platform that were absent earlier. The addition of new functions is termed software enhancement. The enhancement of the platform post-deployment is a process that involves many steps. Constant debugging, monitoring, and maintenance of the platform ensure the smooth operation of the platform. Do you want to implement telemedicine in your hospital? Are you looking for a HIPAA-compliant, Health Insurance Portability and Accountability Act, telemedicine platform? We are a domain expert in the healthcare IT field and have more than 10 years of experience in providing comprehensive solutions for healthcare needs. We have made 450-plus apps and websites for this domain across 35 countries. We provide a telemedicine platform with robust back-end architecture and beautiful front-end customizable UI,